That's me. Hi, everyone. I think most of you know me in some capacity, but for those that don't, my name is Lauren Dollarhide. I am an LMFT and an adjunct instructor in the MFCC program at Fresno State. So what I am going to be presenting on today is more Medi-Cal stuff, but really biop note format in particular, which is just really the format that Medi-Cal likes to see for progress notes, and talking about what that looks like in terms of billing standards for Medi-Cal. Um, so I think progress notes we can all agree upon for those of you guys that are seeing clients is probably like the worst part of our job and the part of our job that we often maybe put off, or you don't take those few minutes that you have in between clients to do your note. You need to go to the bathroom and get something to eat and all that good stuff. So and I think part of at least my experience when I first started out writing notes was that I was making them way more complicated than they needed to be. I think some of my former supervisors can attest that I would have like paragraphs, right? And it didn't need to be paragraphs. So just like Renee mentioned, in terms of like short and concise and to the point, that's what Medi-Cal likes to see in terms of your progress notes as well. So in terms of just what are biop notes, most of you guys might be using a SOAP note format. So it's just another acronym here. And in this case, it's going to stand for behaviors, interventions, outcomes, and plan. Really, like I mentioned, clear and concise and effective documentation is what Medi-Cal wants as far as their billing requirements. And in order for you to be reimbursed, whether it is that you're working through an agency, during your time as an associate, or whether you take Medi-Cal as a licensed therapist and you're doing private practice, we just want to make sure that documentation is appropriate because really it makes it easy for treatment compliance, reimbursement. So you get paid, your agency gets paid, and then also continuity of the care for the client. So in terms of components of the biop note format, we have the behavior section, which is going to be observations of the patient's behavior during that specific section. And I'm going to go over each of these sections in detail. This is just kind of an overview. In the intervention section, we have specific therapeutic interventions that you use during the session. So I like to think of this section as like what happened during session, what did you do? And then the outcome is the immediate outcomes or effects of the interventions during session. And so, again, this is kind of like what happened as a result of what you did. And then the plan is going to be any future treatment planning that you have, any changes for the plan of care, continuation of a current intervention or a current maybe topic that you're delving into with a client. Oftentimes in the plan section, I will also put when the date of the next appointment is, and I'll talk a little bit more about that. That should not be all that's in your plan section, but we'll talk a little bit about that when we get to the plan. So in terms of the behavior section, we really want to focus on observable behaviors here. So we want to be documenting what the patient says, what they're doing during session, and really trying to use objective descriptive language that really captures and paints a picture of like what's going on in the session around the client's actions, verbal expressions, emotional responses. Usually when I think of the behavior section, I'm usually thinking of like my first 10-15 minutes with the patient a lot of times when we're doing like a check-in around maybe I'm using like scaling questions to check in around how the week went. Are they showing up late to session, right? That might be something that you document in observable behaviors. Are they presenting as really anxious, right? And if so, what does that look like? And so we want to try and avoid interpretations here and really stick to the observable facts rather than, because I think as therapists, we're constantly thinking about, well, what does this mean, right? And trying to make sense of it from our lens, which, yes, is important. And also, that's something that's very personal to you. And so insurance wants to know like what is actually happening, what are the facts, what's observable. So we want to try to avoid making assumptions about what the patient's thinking or feeling, and we want to be really specific here. So I think a lot of times one of the common things that I see in the behavior section is like client was anxious or patient presented as anxious or depressed. Like, well, what does that mean, right? So really describing those specific behaviors that indicate what anxiety means, what depressed means. So anxiety, it might be like, hey, the patient's voice trembled when discussing family, right? And they were tapping their feet or their leg. Or, we could tell that they were anxious because they were pacing the room for several minutes. So just being more descriptive around what that means. A lot of times what I like to write is like client demonstrated, symptoms of anxiety as evidenced by blah, 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 whatever was observable. And then you can also, and I'll talk about this in a second, also put in clients or patients language in here too. So if they are saying like, oh yeah, I feel depressed because X, Y, and Z happened, you might choose to use like some short quotations and put that in the behavior section as well. And then we want to make sure that the language in the behavior section is clear and concise. And really, it's for the continuity of care for the client. A lot of you, especially working for like the county or any other agencies where you're going to be part of a multidisciplinary team, you might have other professionals reading your notes, whether that's the case manager, psychiatrist, whoever it is that's a part of this patient's care team. So you want to make sure that like your notes make sense and that someone can read the note and easily tell what happened in that note. So here's some examples of the behavior section. So patient arrived 15 minutes late, appearing disheveled and avoiding eye contact. During the discussion about recent stressors, they repeatedly tapped their foot and fidgeted with their hands, right? Some other ones here, patient spoke in a low monotone voice when discussing their feelings of depression. They paused frequently, looking away, sighing before answering questions about their mood. So those are all, as you can tell, like you can almost picture that happening for the client and what that kind of looks like. And then the third one, patient became visibly excited, speaking more rapidly, gesturing when sharing their progress and managing their anger. They recounted a specific incident where they used a breathing technique to calm down, demonstrating the steps that they took, right? So a lot of times, like I said, behavior section is usually kind of your check-in with the client or the patient when you're first starting out and kind of discussing how the week went, how they're managing their symptoms, and kind of what they're bringing into session. And then in terms of the intervention section, what we're looking for here is specificity, a rationale, and then evidence-based practices. So under specificity, we want to be sure that we are clearly describing what therapeutic technique or intervention we're using and any adjustments that we made to it to adapt the intervention to the patient's needs. So for example, the way that you do empty chair is not going to look the same across the board, right? So if you choose to use that intervention, that might look very different depending on like developmental level of the client, where they're at in terms of being able to process their emotions, cultural implications. So you're just going to want to especially if maybe you needed to prompt the client maybe around some things, like those are going to be the specifics that you want to put in this intervention section. And then the rationale, kind of like Renee was mentioning, the treatment plan should really talk about like why each thing is happening, and same with your progress notes. So your progress notes should really be speaking to the treatment plan. So every week when you're writing your progress note, like Medi-Cal or whatever insurance you're billing, you should be able to say, okay, like they did this intervention because this was a part of the treatment plan. So you want to explain why each intervention was chosen, linking it really to the patient's overall treatment goals and really the observed behavior during session. So if the patient comes in and they're demonstrating some depressive symptoms, you're probably not going to be working on anxiety that session, if that makes sense. So whatever kind of they're presenting or you're observing, that's probably going to be the direction that session takes. Granted, there might be times where you're doing a couple of different things, right? So it's not just going to be that you have one intervention. These are just really made for you guys to see kind of how these should be written out. Under evidence-based practices, we want to, whenever possible, try and use evidence-based interventions and really talk about why it supports the patient-specific issues or diagnosis. And so some examples of this section would be if we are using CBT, right? So we're implementing cognitive behavioral therapy or CBT exercise, focusing on challenging and restructuring negative thought patterns related to patients' self-esteem issues and their expressed feelings of worthlessness and the impact on daily functioning. So we highlight here that like patient is feeling anxious, having some difficulty with thought patterns related to their self-esteem, feeling worthless, it's impacting their day-to-day. And so we're using the CBT exercise. And then we're talking about what we did. Therapist guided the patient through identifying 3 core negative beliefs and developing counter statements. Another example is you can conduct a mindfulness meditation exercise. Maybe you're guiding the patient through some deep breathing, focused attention exercises to manage the acute anxiety symptoms. Maybe because the patient reported an increase in panic attacks during the week. So if that's going to be in your behavior section, that there's an increase in panic attacks and that's what they're coming in with, then what are you doing to address that? Okay, you did a mindfulness meditation exercise. Therapists utilized a narrative therapy approach, encouraging the patient to recount a recent event where they felt overwhelmed and to reframe this narrative from a position of strength and resilience to empower patient and shift their perspective on handling stressful situations. And this is based on their goal to build self-efficacy. So always we want to talk about like, how does the intervention relate to the patient's treatment goals, and how does it relate to what they're bringing into session that day? I'm going to check the chat really quick. I just want to make sure. Okay, this has nothing to do with me. Never mind. Okay, so the outcome section. So we're looking at directly linking the outcome section to the intervention that we just did. So we want to clearly connect the outcome to the specific intervention or technique that we just used. And we want to talk about how the patient's behavioral or emotional state changed as a result of the intervention. So here I like to use both objective and subjective content. So I might have an observable change in behavior, you know, like I might see that like, hey, their shoulders relaxed a bit, they stopped tapping their foot. And then also there might be some subjective report from the client or the patient about their internal experience. So they might actually say like, oh my gosh, when we were going through that exercise, I thought about this, or I literally feel like a weight was lifted off my shoulders. So in the outcome section, I will also use quotations or short quotes around like what the patient is reporting as a result of that intervention that we used. Use quotes sparingly. I will say that I think sometimes folks can get carried away and like give a full-on narrative of what happened for that session. And really your narrative style notes, or the notes that are really long, should really be your crisis notes where you're assessing for crisis, because yes, we do need to know like what their responses were to this and that and what exactly did you do next. But I want you to think of general progress notes where there's not any crisis. You're probably not going to want to say, you know, they said this and I said that and then we did this. So just kind of a brief overview of like how the intervention went. And then in terms of short-term versus long-term outcomes, a lot of times our progress notes are focused on kind of the short-term, right? What happened in that session as a result of the interventions, but also we might want to mention any implications for like overall long-term treatment goals. So some examples of those here would look like following the CBT exercise, the patient identified one core negative belief and successfully created 2 counter statements, reporting a slight decrease in feelings of worthlessness. And they demonstrated a tentative willingness to challenge negative thoughts outside of therapy. And I would add to this part probably, like I would say what, you know, tentative willingness, like maybe they shared with you some ambivalence about doing this, or they were kind of worried, and so I might put in quotes like that they said, you know, I want to do this but I'm worried about X, Y, and Z, maybe that they shared. Also it might be that I think like these examples that I have provided are written to the fact that the intervention like worked and that they got some relief, but there's also the chance where like your interventions fall flat, right? And so that's also okay to write in the outcome section and to talk about like maybe those barriers, maybe you're processing with a patient why they had difficulty in creating those 2 counter statements. Maybe you had to do a lot of prompting for them. So those are all things that can be included in your outcome section as well. So after the mindfulness meditation session, patient expressed feeling calmer, more present, with a noticeable reduction in physical symptoms of anxiety. So they reported decreased heart rate, steadier breathing, less tapping of their feet. So again, these are all ones that kind of show a, I would say, positive result of the intervention, but it could be that your intervention falls flat, and those are all important things to consider in the outcome section as well. So in terms of the plan section, this is going to be your very last section. And I think sometimes I will say this is myself where I get lazy and I'm like, okay, going to see the client next week, you know, but plan section really should be that you are defining clear and measurable goals for future sessions, linking them really to the overall treatment plan. Like I mentioned, the treatment plan talks to the assessment and the progress notes talk to the treatment plan. So it's kind of like that golden thread of documentation that I think you'll, if any of you guys work for the county already or do work for the county in the future, they always talk about that golden thread between those three things. And so in terms of intervention strategies, you might be indicating here what specific therapeutic interventions or techniques you want to use during the following session, and you might want to provide like a short rationale why, so like we'll continue to utilize CBT techniques to address patients' cognitive distortions leading to feelings of worthlessness, right? That might be something that would be sufficient for a plan section. This is often the shortest section of your note, by the way. And then you want to, as much as you can, involve the patient as well. So you want to emphasize the importance of involving them in the planning process. So making sure that what you're planning on doing next week actually aligns with what their preferences are, their goals, their feedback, why they came in for treatment. If they felt like, hey, the CBT stuff is not working for me, then we should really be talking about, okay, what might work for this patient in terms of like our therapeutic approach and the theory that we're using, or maybe we need to modify our theory because it's not necessarily working the way that we're implementing it for this patient. And then always, like I said, I usually put in the plan section, the very last sentence is when the next appointment is, just to hold myself accountable, hold the client accountable that we made this plan to see each other. Especially, most of you guys are going to see your clients or patients on the same day every week. But in the event that like you're going to be out of the office, that might be something that you document in the plan section, and that you instructed the patient of these resources to reach out for while you're gone, especially if it's like an extended vacation or something of that nature. So in terms of examples here, you might see like we will continue to build on the CBT techniques by focusing on identifying additional negative beliefs and developing counter statements. And maybe the patient agreed to keep a thought diary, right? Recording instances of negative self-talk, practicing the use of counter statements outside of treatment. You might plan to introduce another mindfulness exercise. So maybe next week you're going to do progressive muscle relaxation instead to further their development of their coping skills to manage their anxiety. And then you're going to maybe review with them how the mindfulness meditation is going or how it went outside of session. And really every week we should be tailoring our approach based on like what worked, what didn't work. And then next session, we'll focus on exploring and reframing another personal narrative, right? Patient is encouraged to think about a recent situation where they felt overwhelmed and bring this to our next meeting for discussion. So this just kind of lends to what you're going to do next week. And I will say this is always the section of the note that I review, especially if like I have a larger caseload or I have a lot of stuff going on outside of like just seeing clients. I'll review this plan section for every client or every patient before I see them, just to remind myself, okay, this is where we left off. This is what, we wanted to talk about, or this is what they brought up at the end of session that we agreed to explore in this next week. And then finally, just some other considerations. We always want to be mindful of any cultural factors that can influence behavior and expression of emotion. So the thing that comes to mind for me, especially, is grief. So there might be some cultures, some religions where, like, let's say, seeing the person that they loved that has passed away, right? Like, I think a lot of times if we hear someone saying like, oh yeah, I saw them, but they're dead, right? We might start pathologizing that and saying like, hey, this person's having like hallucinations, delusions, but that can be very normative given maybe their religious background, cultural background, right? Spiritual background. And so just being mindful that our documentation should also reflect that. I think whatever we put in a progress note or any kind of clinical documentation can be read by insurance, right? If you're billing insurance. And so just being mindful of the implications that that can have on individuals. And really our documentation should always reflect an understanding of their cultural background. Including direct quotes, like I mentioned, can be really valuable, more so in the behaviors and outcomes section, because it really helps illustrate the patient's state of mind and any perspectives. Again, don't go wild with this and like make like, your whole section of these like quotes, but I love like little paraphrases and little words. I think Renee mentioned too, like kind of being specific around like what does anxiety mean for the client or the patient, and putting that in your note. And then always encouraging patients to share their perspective on the effectiveness of the interventions and the treatment. I think a lot of folks are moving towards, or a lot of agencies are moving towards collaborative documentation or measurement-based care where they are getting feedback from the patients around like how treatment is going, how they feel about the therapeutic alliance, and all of that good stuff. So even if your agency is not doing that, it's something that I do with my patients as well, is just making sure that like, hey, is what we're doing working? And if not, like, what can we do more of? What do we need to maybe modify? And always checking in with them. I think that can be really beneficial, especially for your working alliance. Um, okay, that is it for me. Thank you. And I don't, in the interest of time, I think I'm going to hand it over to, is it Francis that's going next? And then we can have questions at the end, or you can pop them in the chat and I can respond too.